You may go.
Hair is the first thing you notice in someone. And apart from enhancing your looks and contributing to your aesthetics, hair is also a reflection of your overall health. After all, it is a crown you never take off. With the current weather changes and the aftermath of the pandemic, the dynamics of hair care has changed. And hence, for the same reason, we are here with our yet another master talk on hair care in the current scenario. A very good evening to everyone present here. I am Priya Vishwakarma, your host for this evening. Let us welcome our dignified guest for today's session, Dr. Dixant Chhikara, a renowned dermatologist who is here to debunk all the myths and share insightful tips and tricks and everything that you need to know about hair care and management, along with the well being of your scalp. Dr. Dixant Chhikara is an MBBS IFAAM from Germany. He is a consultant aesthetic physician and trichologist. He is also the founder and chief consultant at Skincare. He is a member of AACR and he is also the member of Indian Society of Aesthetic Medicine. So we are truly glad and grateful to have your presence in our session. The mic is all yours.
Thank you, Priya. So my name is Dr. Dixant Chhikara, as she told, and I'm a trichologist and aesthetic physician based in Delhi. So today I think I'll be answering your questions upon hair loss according to the season, and I'll try to answer all your questions and be satisfied with my answers. Thank you.
Okay, sir. So if you are ready and if our audience is all set with their favorite beverage, we may begin this question and answer round. So since we are talking about hair loss, so I'd be starting with the very basic question that what is hair loss? What's normal and when to be concerned?
See, as you all know, hair loss is normal in every person. And average hair loss in a day is about from 100 to 150 hair strands per day. But we need to understand that this number, without any apparent thinning of hair, is called normal hair loss. And whenever a person is losing and observing excessive amount of hair loss, as he or she is seeing in normal days, at that time we can say the hair loss is increased and with apparent thinning of hair follicles and hair strength. So at that time the person should always go to a trichologist or a dermatologist as soon as possible.
Okay, sir. I think our audience might be noting down. If they are not, then I would strongly recommend them to sit with a paper and pen and note down everything doctor is sharing with us today. So that brings us with the next question. So what are the general causes of hair loss?
See, hair loss can the causes for hair loss are like very large. The causes are many in number, but to simplify it, I can differentiate into three categories. Like we can say from stress, let it be physical stress, chemical stress, or any mental issues or mental stress also. So in physical stress, I would say like using hard water for hair wash and using excessive amounts of cosmetic products on your hair without consulting your doctor, just by looking online or by Google, and like having a bad diet, low protein, any nutrient deficiency in the diet can cause to hair loss. And in chemical stress, I would say different hair therapies that are being done in salon these days can also lead to hair loss, and any reaction to any medicines due to some infections, which we call telogen effluvium, and some by hormones also, like androgenetic alopecia, male and female pattern baldness. So that also leads to hair loss. And mentally also, if a person is going through depression or is on depressive medicines, like antidepressant medicines, that can also lead to hair loss. And some different causes like burns, injuries, or X-ray radiation exposures can also cause to hair loss also.
That was a really insightful answer, sir. Thank you so much. That brings, as you talked about depression. So the next question is on the same lines. Can a person's lifestyle play a role in hair loss?
Yes, the lifestyle plays a huge role in hair loss, especially depending on what kind of food they're having. Any habits like smoking and excessive alcohol consumption plays a major part in hair loss. And if a person is depressive, it also causes hair loss because the chemical stress on the hair follicles is increased at that time. And especially depending upon the medication that the person is taking. And with time, different habits like washing hair in hot water can also lead to stress, causing hair loss and hair thinning also. And many people in India tend to dry up their hair by just vigorously rubbing their hair by the towel, and that can also cause some physical stress to the hair follicles and can cause hair loss.
Right, sir. So, do you think that nutrient supplement can prevent hair fall in that case?
These days, we are seeing a lot of children going on diets without any medical supervision or without any expert advice. And by that, what happens is they get nutrient deficient. And because their protein is low, they're having less of vitamin E, vitamin K, and also vitamin C. And but if we talk about in cases of anemias, if a girl is losing blood, like excessive blood during her periods, that can also cause to anemia, iron deficiency, and that can also lead to hair loss in those cases. So nutrient plays a role in loss of hair.
So, which nutrients are vital for hair growth?
So nutrients, firstly, by what our hair is made up of, keratin proteins, and the chain of proteins, what makes the hair. Hair strength also is determined upon keratin. Biotin plays a major role. Vitamin E plays a major role. So supplementation should be done, but always under the supervision of a certified doctor or a trachologist.
So, as you said that you should always consult a dermatologist or a trichologist. So, there's a ongoing craze about green tea for everything. So, do you think that green tea play any vital role in preventing hair fall?
See, what green tea does is it contains antioxidant principles and features. So it can help to a bit, but it won't rule out the reason. First, what we need to do is make a proper diagnosis. We should know why the hair is falling and what is the cause behind it, and to treat the cause instead of just gulping up some green tea and expecting the hair loss will stop or something like that would happen. But I would say that it doesn't play a huge role, but it surely helps a bit.
A bit. So, you should not completely rely on green tea.
Yes.
Okay. So, sir, what are the medical treatment options for hair loss, and specifically topical, oral, non-surgical, and surgical? So, if you could let us walk
Yes.
through in each one.
See, it is a very huge part if we go inside the treatment for hair loss. First, we need to decide what's the cause behind it. A proper medical history should be taken. Their hormonal history, if the girl is going through PCOS, every 1 in 3 girls is having PCOS these days. And if the person is anemic, are they having any nutrient deficiency, or just because of hormones or their genetics, they are losing their hair, like in the case of endogenetic alopecia, the male and female pattern baldness. And there are different methods, different modalities that can be taken to prevent hair loss and to increase the production of hair follicles and increase the nutrients for the follicles also. So first, we can go into the topical treatments. The number one gold standard product, many of the normal people are also in layman language, everyone knows about it also, is minoxidil. It comes from 2% to 10% concentration, and mainly in females 2 to 5% is used, and for males 5 to 10% of minoxidil is used. And there are different alternative for minoxidils also, like mnexil, or mnexil is a new drug in the market. What it does is it causes vasodilation, which increases the blood flow to the follicles and increases their nutrients for the follicles, and helps providing more growth factors. For the oral medications, we can use 5 alpha reductase inhibitors like finasteride, dutasteride, or alpha tradiol. So these are some medicines which can be used. Finasteride is used majorly. Dutasteride is not FDA approved as of now and is not used in India, but it is available sometimes in the market, because something special about dutasteride is it just does not block 5 alpha reductase 1, and sorry, 2 in the case of finasteride. It blocks both the 5-alpha reductase 1 and 2. And some anti-androgens can also be used if the cause is hormonal, like spironolactone, flutamide. And in some cases, if dandruff is playing a role for hair loss, so ketoconazole is also used. And these are the topical and oral treatments. Then comes non-surgical. In non-surgical, PRP plays a very good role. So what we do in PRP is we make a concentrated. It is PRP means plasma rich, platelet rich plasma. Sorry. And what it does is we make a concentrated form of plasma in which the platelets are more in number, and it contains growth factors. So we inject the growth factors directly into the scalp, providing the proper nutrients and proper energy for the follicle to grow up and enhance the hair production. And other treatments are also available, like microneedling, derma roller. Many people know it. There's a drum on derma roller and many small fine needles on it. And some derma pens can also be used to do microneedling in such cases. And there are some LED treatments also available to stimulate the scalp, to stimulate the follicles for the growth. And if we go into the surgical method, it contains hair transplant. There are two type of transplant being done. One is FUE and one is FUT. The basic principle is we extract the hair from the back of our head and place it in front where the hair fall is happening. The reason we take it from back of the head is because the blood flow is more, and there it is a permanent patch. So the hair fall doesn't usually take place at the back of the head. So it is the grafts are very healthy, very viable to be placed in front where the hair loss is happening. Or if in some cases the hair is not available in the back of the head, then we can use beard, chest hair, body hairs. There are many options.
Okay, so I think that covers most of the entire sector that we wanted to know. So that was a very elaborative answer. Thank you so much for touching each part of it. Now, a very basic question that most of us do not get it correct. Sir, any tips on head wash or head bath?
See, main thing, the products that you're using, if it's OTC product or any medicated shampoo or conditioner the person is using, they should always consult a dermatologist first if they are having any hair loss or something. But in normal routine, one should not use hot water for shower. Always use cool or room temperature water. That is better because hot water will increase the sebum production, the oil production, which can cause to dandruff and later on to hair fall also. And normally for the drying up of the hair, so the person shouldn't put any physical stress or physical force on the hair follicles when mainly when it's wet after the shower. And oiling, it is a big stigma in India to do oiling on everyone from childbirth. They start doing oiling on the scalp and all, so that should be like avoided to a bit. And the person should always ask their physician whether to which kind of oil they can use, or any alternative for oil like serum, some hair tinctures which can use as irritants. And always avoid using home remedies or any YouTube remedies, some Instagram following, and these influencers are promoting many things. So a person should always consult the doctor first and only then decide what to put on the hair or not.
And I think that was really important for all of us following everything so blindly. Thank you so much for saying that out loud. So my next question is, how does dandruff happen and is it contagious?
See, first we should know how dandruff happens. Many people think it's just scaling off of the dead hair, dead skin, the dead scalp. But what actually happens is there's a fungus called Miselia furfur. So everyone has it on their scalp. It stays on the scalp, and it feeds on the oils produced by our scalp. So the sebum. So what this fungus does is when it feeds on the sebum, it releases some lipases, and these lipase break down the sebum into and produces some free radicals, which can further get into the scalp and irritate the scalp. And by this, the skin starts its own defense mechanism. In response, it starts shedding off the skin and producing more fresh skin cells rapidly. So this shedding off of the skin can cause dandruff problems. The dandruff which the person can see is caused by that fungus. And it can be contagious because, as everyone know, when treating skin fungal infections or seborrheic dermatitis for the hair, if the person is using same towel, same comb, it can be contagious as the fungus can be transported from one person to another, and it can start causing dandruff problems in them too.
Thank you so much, sir, for answering that question. So we have one question from our viewer. Uh, I will read out loud on the person's behalf. As a seafarer, I am exposed to humid air most of the days, which may lead to hair loss. Can you please share the preventive measures in order to avoid hair loss?
See, in a humid condition, and even like in these days, the monsoon weather, what happens is the oil production increases in our scalp, which can cause again to seborrheic dermatitis, leading to hair loss. So, what a person should do is regularly wash their hair by a shampoo, using some shampoos or lotions containing zinc parathione and ketoconazole in them to prevent dandruff from happening, and to keep a proper hygiene and try to keep the scalp dry by like daily shampooing and all. So this will prevent the hair loss.
Sir, as we were talking about before this question, I hope our viewer is satisfied with the answer that doctor just gave away, and it helps him or her with the hair loss due to humidity. So, as previously we were discussing about dandruff, so that brings me to my next question: that what are the treatment options available for dandruff, and what is the typical duration of the treatment?
See, yeah, as I just told, there are some lotions and shampoos available in the market which contains ketoconazole and zinc parathione. These two elements play a very major role, as ketoconazole is an antifungal agent which helps in killing off the mesolia for fungus in the scalp. And the person should also be going for conditioning of the hair and regular wash. See, a proper maintained dry hygiene practice will always lead to prevent these dandruff and these fungal infections into them. And usually what we prescribe to a patient is using these ketoconazole and these lotions and shampoos is up to thrice a week, but and it can go up to 1 month, maximum 1 month, if the person is having major dandruff problems. And if it's normal and minor, it can be treated in 2 weeks itself.
I think the duration depends largely on from patient to patient. Okay. So now that India is so diverse with its season, and we have shifted from summer to monsoon, and the rain gods have been very, pleasant to us. So, do you have any special hair care tips for monsoon?
See, for monsoon, I would again stress upon washing your hair regularly by shampoos, and try to use a medicated shampoo would be better instead of going just for the any OTC product or any product which is having some offer or something. And keep a proper hygiene. In males, if possible, keep short hairs. For females, put any serums or tincture if he or she is having any hair fall problems for the starting. And always, if you have any problem, any doubt about a hair, always consult your physician, because if it gets too late, then we are too late, we can't treat it.
Correct, sir. So, sir, those were pretty much all the questions from our side. We would be really glad if you would want to share anything on this platform. Our viewers would be very much grateful to hear it from you.
Surely, the first point I would like to say is just don't blindly follow what other people are saying to you. If something has worked for them, it isn't necessary that it will work for you also. Every human, every skin, every scalp is different. Everyone needs a different care. Everyone needs different altitude of care, and the person should always consult their physician, as I'm again and again saying, because many people do trying to like start medication by themselves. In some females, if they are having some hair loss, and they start just by going up to 10% minoxidil, and then it can cause up to hypertrichosis, which is like facial hair, increase in facial hair or body hair. and then they have to go into laser hair removal treatment. So everything has its complications also, and every kind of treatment should be used in moderation under supervision of a physician. And always believe your physician and trachologist. Don't go for doctor shopping, trying 10 kinds of treatment, going searching for online, applying some ginger, lemons, and different things, things including sulfur. It will always irritate your scalp, it will burn out your scalp. And keep a proper hygiene. A proper diet and proper hygiene will always help you to prevent your hair loss.
In today's world of free internet, I think that was a big call to everyone who follows everything blindly, sir. So we all are very glad that you were here with these set of questions. We come to the end of our hair care session. Thank you so much, Dr. Dikshant, for gracing our session by sharing your knowledge and helping the lot of us. Thank you, audience, for your time as well. Stay tuned for more such sessions. Until then, do not forget to incorporate whatever our doctor has shared today. Good evening to everyone else. Stay safe, stay healthy. This is your host,